So what could a tooth that's broken way down and a smile that just seems a little, well, gummy, possibly have in common? I mean, they sound like totally different worlds, right? One's a structural crisis, the other's all about looks. But believe it or not, there's a single, really elegant surgical solution that tackles both. Okay, so let's get right into it. We're looking at two completely different scenarios that lead a patient to the dentist, but they both point to the exact same procedure, something called crown lengthening. So on one side, you have the functional emergencies. A tooth snaps off right at the gum line, or maybe a cavity gets so deep it's hiding way under the gums. In these cases, the dentist literally has nothing solid to grab onto to build a new crown. Then, on the other side, you've got the aesthetic stuff. This is when someone feels like their teeth look kind of short, or their gum line just isn't even, giving them that gummy smile. So this is the big question, right? How in the world can one single procedure fix a broken down tooth and also refine the look of a smile? What's the common link? Well, it all comes down to needing to get access to more of the natural tooth. And here it is, crown lengthening. Put simply, it's a surgical procedure where a specialist, usually a periodontist, carefully exposes more of your tooth. They do this by reshaping the gum tissue and pretty often the bone underneath it. The end goal? Either to give your dentist enough tooth to anchor a crown or to create a beautifully balanced smile. But to really get why this has to be done with such precision, we need to dive into a little biology. See, our bodies have some very, very strict rules about the space around our teeth. They are not negotiable. And that crucial space has a technical name, the supracrestal tissue attachment. You'll also hear dentists call it the biological wit. Basically, think of it as a natural biological seal that connects your gums to your tooth. Its whole job is to protect the bone underneath. It is the body's mandatory keep-out zone. And that zone has a magic number, about 3 millimeters. Your body absolutely demands this much clean space between the edge of a crown and the bone below. If you violate that space, if the crown gets too close, your body freaks out. It fights back with chronic inflammation. Your gums will bleed, and you could even lose bone. So rule number 1 is simple. You have to respect the 3 millimeters. All right, so once we've made biology happy, we have to satisfy the laws of physics and engineering. For a crown to actually work and last for years, it needs something to hold on to. That's where this concept, the ferrule effect, comes into play. The best analogy is thinking about the metal bands on a wooden barrel. Those bands are what hold the whole thing together. A crown needs that same kind of 360-degree hug on solid tooth structure to keep the tooth from breaking. So how much of a hug does it need? Well, the engineering standard is a minimum of 1.5 millimeters of tooth height. That's the bare minimum you need for that ferrule grip to work. If you have any less than that, you're taking a huge gamble that the whole thing, the crown and the tooth, is going to fail. And this is where it all comes together with some really simple math. You take the 3 millimeters that biology demands, you add the 1.5 millimeters that engineering requires, and you get your grand total, 4.5 millimeters. That's it. That is the magic number, the absolute minimum amount of healthy tooth that needs to be sticking out above the bone for a dentist to place a crown that's going to be both strong and healthy for the long haul. So, if we need to get that 4.5 millimeters of tooth exposed, what are we actually reshaping during the surgery? Is it just a matter of trimming back the soft pink gum tissue? Well, not exactly. There's a fantastic saying in the world of periodontics that just nails it. The tissue is the issue, but the bone sets the tone. What that means is, while the problem might look like it's just too much gum tissue, the final shape and position of those gums is totally controlled by the shape of the bone underneath. So to get a stable, predictable result, the surgeon has to reshape the bone first. The gums will then just naturally follow that new blueprint as they heal. But, and this is really important, this procedure isn't a silver bullet for every situation. It's perfect for the cases we've been talking about, but check out the contraindications on the right. It's absolutely not the right choice if a tooth is just fundamentally broken beyond repair. Why? Because doing this whole surgery would be like building a gorgeous new house on a foundation that's already crumbling. It's just not going to work. Okay, so let's fast forward. The surgery is done, everything went well. You can't just pop the final crown on the very next day. The body needs time, serious time, to heal and for everything to settle into its new position. So the key word here is patience. For the first 3 months, the gums are doing most of their healing, but they can also do something called rebound, where they creep back up a little bit. For a back tooth, a molar, you might be able to place the final crown after about 3 months.
But for any tooth that's in your smile, dentists are going to wait at least 6 months. Rushing this step is a huge mistake because the gums could shift later on and completely ruin the final look you waited so long for.
So, as we wrap this up, what is the single most important thing to take away from all this?
It really all boils down to a few key ideas. First, you have to start with a super thorough evaluation. Second, you always have to remember that the bone is in charge of where the gums end up. Third, and I can't say this enough, you cannot rush the healing. And finally, you have to expect a little bit of that tissue rebound. It's just a normal part of the process. This is a procedure where biology, engineering, and art all have to come together perfectly.
And that leaves us with a really fascinating thought, doesn't it? Whether we're talking about saving a broken tooth in the back of your mouth or perfecting a smile for the whole world to see, the difference between success and failure really does come down to just a few critical millimeters. It's an incredible reminder of the amazing precision behind modern dentistry.